So NAS is neonatal abstinence syndrome, and it has to do with newborns at birth who were exposed during the pregnancy to medications or substances that when at the time of birth they then go through withdrawal because they are no longer being exposed to those medications or substances. So we can see NAS from exposure to many different substances, but for our talk today, it'll be the exposure that they have to narcotics, opiates, but also marijuana and some other prescribed medications as well. And so just like a person who suffers from substance use disorder, when they stop using, they start showing signs of withdrawal. We see that in the neonate as well. And our pediatrics team, our neonatal and newborn nursing team works really hard to help those children come through that period.
So we implement this tool called Eat, Sleep, and Console, and the parents are super involved with this tool that we have. Initially, we like to, before the baby's even born, get the parents involved and what to expect and what we're going to be looking at once the baby is born as far as withdrawal symptoms go. Every 3 to 4 hours, we're looking at how they're eating, how they're sleeping, and how they're consoling. And if there's any issues with any of those, then we have a huddle with all of the team members, including the parents, the doctors, the nurses, and we decide what would be best for this baby as far as treatment, or if we try as best as we can to use non-pharmacological treatment, because a lot of the times some of these babies just need extra support as far as non-pharmacological intervention.
We can't monitor the fetus going through withdrawal, so we don't recommend in pregnancy that women go cold turkey from their opiate abuse. However, being addicted to prescription pain medications or heroin or fentanyl, usually to support that habit results in some behaviors that are further detrimental to the patient. Buying medications off the street, prostitution, other kinds of high-risk behaviors that put them and their pregnancy at risk. And so during pregnancy especially, we work closely with our partners across central New Hampshire to get those patients, to get those women in quickly to an MAT program, medication-assisted therapy program, whether it is methadone, which has been used for decades, or more recently Suboxone or Subutex. And the reason that we get them on those is that we can control the medication. We know it's a clean medication. We know it's a legal medication. It's covered by insurance, and that that addresses the craving that is the core of the illness. But it's not just that, it's much more than that, because once the craving is under control, we work with a team of people, whether it's the primary care physician or the mental health counselor, social worker, and then the addiction specialist. We work closely as a team to address those other parts of the life that have fallen apart during those years of abuse. Are there relationships that need to be mended? Maybe there's some food insecurity. Maybe there's housing insecurity. So all of those things, our social worker will help assist to make sure that we can provide everything we can so that patient is successful in her pregnancy. And so we kind of capitalize on that innate feeling that pregnant women have of treating their bodies well, because women have an innate interest in treating their children well. And so we capitalize on that, and we get them hooked up with the MAT program, with counseling, and really to get them hooked into a program so that we help support their sobriety and their abstinence during the pregnancy, maintaining their cravings with that MAT. And then afterward, our pediatric team will work closely with the patient and their partner with their child, and then we will continue to support in that postpartum period their continuation with the addiction team to keep the patient free from previous abuse. We ask all pregnant women and screen all pregnant women for opiate use, and at that point we are here in a non-judgmental way to connect them and really focusing not on the past, what got you into this, but where are we today? What can we do to optimize your health? And what can we do for the future health and safety of your child? And so I would say to our community, if you yourself have found yourself in a position of using opiates, services are available through any of the Speare practices or through Mid-State Health Center to get you hooked up with someone in the area. And certainly if you or you know of someone who is pregnant and is using, please encourage them to come talk to us.